Hello. This is Dr. Haseeb Aman. I'm practicing at Medifit Clinic, Panli Road, Bangalore. I'm a physician. So today's topic is about pedal edema and CKD. What are its causes, symptoms, and treatment? So welcome you all to this session where I will be talking about pedal edema, CKD, and here we'll explore what is pedal edema and how it relates to chronic kidney disease in best way, how to manage it. So first, let's see what is pedal edema. Pedal edema is a condition where there is extra fluid that is accumulating in the lower legs, feet, causing them to swell. This swelling can happen for several reasons, such as heart problems, liver issues, thyroid issues, kidney problems, or blood clots. So our body fluids are divided into two main areas. One is inside the cell, outside the cell. The remaining area outside the cells or the blood vessels surrounding edema or swelling occurs where there is a problem when how the fluids are distributed between these areas. So this problem can happen if there is too much pressure that builds up in the blood vessel, often due to cardiac issues or excess fluid. So if it occurs if there is not even enough proteins in the blood, like albumin, which helps to keep the fluid in the blood vessels. Additionally, lymphatic system normally helps to move extra fluid and protein back into the blood. But if this system isn't working properly, the fluid can build up, causing swelling. So kidney plays a very important role in regulating body fluid balance. The kidney helps in removing the waste and regulate the fluid. When they are not functioning properly, the fluid can accumulate to edema, as seen in chronic kidney disease or acute kidney injury and nephrotic syndrome. So edema is one of the major symptoms of CKD. So let us explore how clinicians approach the clinical diagnosis of edema. First, a detailed history helps us to identify what are the risk factors underlying condition like heart failure, kidney disease, or thyroid disorder. Edema can be generalized or a localized edema. So generalized affects the whole body or the entire body, often related to heart disease or kidney failure. Localized edema is one part of the body is swollen, often due to inflammation or blockage of lymph nodes or issues with the blood vessels, with the flow of blood vessels. So during examination, the clinicians will look for pitting edema. That is, when you apply pressure over that affected area, there will be indentation, indicates heart failure or a nephrotic syndrome. A non-pitting edema suggests of a lymphatic obstruction or hypothyroidism. In the cases of renal disease, the following lab tests or imaging can be helpful, such as CBC, renal function test that includes serum creatinine, urine analysis, urine for microalbumin, urine albumin to creatinine ratio, as well as ultrasound of the abdomen and pelvis. A thorough physical examination is important, identifying the causes of specific signs, including management plan. So when it comes to managing edema, the approach depends on whether the cause is local or systemic. For local causes, non-pharmacological treatments are essential alongside with underlying issue. For systemic causes, a combination of general measures and targeted treatment is required. For local edema, non-pharmacological measures include limb elevation, compression therapy, physiotherapy, or ice application. In cases where systemic causes are at play, such as CKD, treatment focus on reducing fluid retention and addressing the underlying issue like salt restriction, use of diuretics that helps in improving the urine output like loop diuretics, thiazide diuretics, or potassium sparing diuretics, that is such as furosemide, metolazone, or spironolactone. The choice and dose of diuretic depends on factors of severity of edema, patient's hemodynamic status, and kidney function. So it's important to use diuretic cautiously to avoid complications like hypokalemia, hypotension, electrolyte imbalance. Regular monitoring of fluid, urine output, blood pressure, weight, periodic tests are essential. So CKD managing edema often requires salt and fluid restriction. High dose diuretics are required, like furosemide are effective. Managing edema involves tailored approach for local causes. Non-pharmacological methods are key. Systemic causes require dietary adjustment, diuretics, and close monitoring. So patient education is crucial. Understanding the condition, following the treatment plan, making lifestyle changes can improve the outcomes, and early recognition and effective symptom management helps in preventing complications. So join us in regarding recognizing the National Edema Awareness Day, that is on 25th of September, to increase awareness and promote early detection of edema and related conditions. Together we can manage and understand edema. Thank you for watching.